Okay, so today we have Llewellyn Sanderson, and we're gonna give her a potassium chloride piggyback and some morphine. First, I'm gonna go through her patient chart. So it's Llewellyn Sanderson, date of birth 117XX. She is a full cold, high fall risk, and she has an allergy to sulfa. She's here because she fell in the ice, fracturing her tibia, and she had an appendectomy as a child. Her medication list is morphine, 2 milligram per 1 milliliter IV push as needed for a pain of 7 or higher out of 10 every 4 hours. Acetaminophen 500 milligrams by mouth every 6 hours for a pain up to 6 out of 10. She has normal saline infusing just for electrolyte replenishment. And then she also has 10 milliequivalents of potassium chloride and 100 milliliters of normal saline that is to be infused over 1 hour as an IV piggyback. Her vital signs are pretty much good, except her heart rate and BP are elevated a little bit, but that is most likely due to her pain, and her pain is 9 out of 10, and she also has a potassium lab level of 3.3. So now I'm going to go into the med room. I sanitized my hands, and then I'm going to do my first med check on potassium chloride, which is for Llewellyn Sanderson, which is due now. 10 milliequivalents of potassium chloride and 100 milliliters of normal saline. This is due to her electrolyte imbalance. There's no damaging on the package. And then we're gonna do our second med check for the morphine. So we're gonna find it in our morphine for 2 milligrams per 1 milliliter, which we have 1 milliliter in our vial every 4 hours for pain 7 to 10 out of 10, which her pain is 9, so that indicates we can give it, and it has not been given, so we can give it now. And then also there is no discrepancies in our packaging, and it is not expired, as well as the potassium chloride. Now I'm gonna move to a different place in my med room, and we're gonna do our second check on the potassium chloride, which is due now for Llewellyn Sanderson. It's 10 milliequivalents of potassium chlorine and 100 milliliters of normal saline, due to her potassium levels being lower. And then we're gonna recheck our morphine as well, which is due now for Llewellyn Sanderson at 2 milligrams per 1 milliliter. It's an IV push every 4 hours for pain. It's due now, and that's for her 9 out of 10 pain. Now I'm going to take my supplies and go into the patient's room. Hi Llewellyn, how are you today?
I'm doing good. I'm in a little bit of pain right now.
Okay, can you rate that for me?
It's sitting at a 9 out of 10.
Okay. Well, I have some medications here for you. First, do you have any allergies?
I do. I have a sulfa allergy.
Okay, it says that in your chart. So I'm Kylie, and I will be your nurse today. First, we have morphine for you. Something to know about that is it causes drowsiness, dizziness. It can cause respiratory depression and constipation. Is that something you're still wanting?
Yes.
Okay. And then we also have a IV piggyback bag for you due to your low potassium levels, which can cause chest pain, muscle weakness, and palpitations. Is that okay as well?
Yeah, that is okay.
Okay. I forgot to mention that the morphine can also cause constipation. You're still okay with that?
Yes.
Okay. Okay. Can you state your name and date of birth for me?
I'm Llewellyn Sanderson. 117XX.
Okay, perfect. I'm just gonna scan your wristband here. All right, awesome. Okay, I'm just gonna complete my third med check over here, and then we'll get started. So we have Llewellyn Sanderson. We have morphine, which is right there, via IV push at 2 milligrams per 1 milliliter, and this is indicated for her 9 out of 10 pain, and due now, and it can be administered every 4 hours. And then we also have our potassium chloride here for Llewellyn Sanderson. It's due now, and it's a 10 milliequivalents of potassium chloride and 100 milliliters of normal saline that's to be infused over 2 hours. And that is due to her low potassium levels. Okay, have you had any pain at your IV site at all?
No, it's been okay.
Okay. So I'm just gonna put some gloves on here. And then we'll get started with that morphine.
We have potassium chloride, 10 milliequivalents and 100 milliliters in normal.
Okay. I'm gonna scrub the hub for 15 seconds. Let air dry for 15 seconds. And then we are going to push 3 to 5 milliliters just to flush out this IV here.
A little low, 3.3, so we are okay to give this, and we will document after.
Alright, and then I'm going to grab another alcohol pad, and we are going to scrub that hub again for 15 seconds. We're gonna let air dry for 15 seconds. And then we have our morphine here, which I forgot to scan, so we're gonna do that now.
So you want to grab the bag. You want to make sure everything's clamped, which it is.
Awesome.
Grab.
All right. During that saline flush, did you feel any discomfort or pain in your IV site?
I did not.
Okay. There's no redness present. So now we're going to administer the morphine, and we're going to administer the 2 milligrams over 1 milliliter over 5 minutes. Okay, and then we're going to take that off.
Grab an alcohol pad. Grab.
And then we're going to scrub that hub again for 15 seconds and let air dry for 15 seconds. And then our last saline flush here, we are going to administer at the same rate of the 1 milliliter over 5 minutes. Okay. Now I'm going to document that was given, and I gave it at 2 milligrams over 1 milliliter for over 5 minutes. Now, Llewellyn, we're gonna give you your IV push medication, and you still wanted that, correct?
Yes.
Okay. Alright, so we're going to rhyme this.
You want to grab the bag, the primary bag, and bring it lower than the second bag. Make sure that you hook up the
Okay, we're gonna fill that
tubing so it's inside of the
halfway
pump, and you want to set the pump at,
and ensure it's clamped.
and we are going to connect this.
And then we're gonna fill it halfway here. Okay. Then I'm going to hang this up.
You're going to grab one more saline flush and connect that to 0.
There we go. Okay, and then I'm going to slowly release the clamp to ensure we get all of the air bubbles out of our line here.
And then you want to connect. Scrub the hub for 15 seconds. Let that air dry.
Okay, so that would have happened in real life. I would ensure none of the medication was lost, but our IV is primed now. This one, and it's reclamped. Our primary IV is also clamped as we are getting this administered.
How do you feel on the
Okay.
Good.
I'm gonna scrub this for 15 seconds. We're gonna let it air dry for 15. And we are going to connect these two. And I'm going to infuse the pump for 50 milliliters per hour. That's over 2 hours. And then we're gonna open up our clamps here. And that.
Alright, Llewellyn. I will be back to come check on you. How is your IV site feeling? It feels good. Okay, perfect. I will come
Alright.
back in 20 minutes to check on your
And then we ensure that we're seeing the drips, which we are.
your vital signs.
And then I will dispose of all of that, but I'm also going to come over here
I will recheck your labs.
and document that I gave the potassium. Is your IV site burning at all?
It's not.
Okay. All right. Well, I'm gonna come back in about 5 minutes to check on ya. Do you have any other questions right now?
I don't think so.
Okay. I'm gonna sure the bed's in the lowest position. The patient has her collar and she's in a comfortable position. Okay. Leave. Okay. Knock knock. Hi, Llewellyn. I'm back. How's your IV site feeling?
It's feeling good still.
Okay. And how about that pain?
My pain has definitely gone down. I would rate it like a 5 out of 10 now.
Oh, good. Okay. So our morphine seems to be working. Our potassium, we have to let that finish going through the IV. So in about 2 hours, we will recheck your potassium levels and we will monitor your vital signs.